morning, good afternoon, whenever you're, maybe good evening, whenever you're watching this. We have a beautiful woman who represents the Senior Services North America. Her name is Cynthia Meacham. You've heard her before. Hi, Cynthia. And Cynthia is really she's the guru for Medicare. She will answer questions that you didn't even know to ask because it's very complicated. And actually, before we even got in the show, I asked Cynthia some questions that I didn't know. So welcome to the show, Cynthia, and let's get you answering these questions.
Thank you for having me, Anita.
It's always a pleasure, Cynthia. So let's go. I asked Cynthia the question, do you have to be 65 to be able to get on any of the Medicare insurance? So why don't you just go and talk about that?
Okay, so you can, if you're turning 65, you have a 7-month window to, sign up for your Medicare plans. But also right now, you can sign up for, if you have a condition, there's plans out there called chronic special needs plans. And those are going to cover people that have chronic conditions, cardiovascular disease, chronic lung conditions, diabetes, just to name a few. Then there's Medicaid, Medicare. Those are called dual plans that they can enroll in. And then they can also enroll in a 5-star plan with their Medicare Advantage as well throughout the entire year.
Okay, well, why don't you explain what is a 5-star plan?
Okay, so a 5-star plan, that they have been rated the highest standard in Medicare. So they are now a 5-star plan. And if you are a 5-star plan, you can enroll enrollees throughout the year. You don't have to wait until AEP. You can enroll in those plans all year round. So those are fantastic. And if the clients are rating them this high, they're being very well taken care of, and they're very happy with their customer service, the networks, the prescription drug coverage, and what have you not.
Does it cost money?
Most of them, no, they do not cost any money.
Amazing. It's really a wonderful thing that the older adults can have this. As a matter of fact, I have often felt that it'd probably be nice to have people in their 50s have this, because that used to be that no one wanted to get to be 65, but now because of insurance, they can't wait to be 65.
That is correct. 60 to 64, your premiums are so high that you cannot wait till you can get onto a Medicare Advantage plan. That is correct.
Right. Okay, so let's talk a little bit. I saw in your advertising about diabetes. So you have to have diabetes, and so if someone calls you, for example, what questions do you ask them so that you know what to answer them?
Well, I can start, if it's this time of year, I will ask them if they have any chronic, conditions and then I will, go, like I said, heart disease, any kind of COPD, bronchitis, asthma, COPD, diabetes. And if they do, I'll ask them, of course, their doctors, what doctors they see, their hospitals, and their prescription medications that they're taking. And then I will look at the plans that offer the chronic special needs plans and see what company is going to cover them, their medications at the least, make sure they have all their doctors and their hospitals and network. But these plans, Anita, they help the clients save even on their medical equipment. If they need oxygen because they have COPD, this plan is going to help them save a lot more on their oxygen than just a regular Medicare Advantage plan would. So they're very, very, very beneficial to those clients.
Okay, so without your knowledge and all the things you tell them, they must be very confused. What do they generally do without speaking to someone like you?
They're calling to a carrier, and then just the carrier will get them signed up on an HMO or a PPO, depending on which route they want to take. But that's why it's always good to work with a broker who understands all these different plans, and that way you can make sure you're getting the most comprehensive plan that suits your needs, because everybody has such different needs these days.
Okay, and I know that your ad says there's no charge for any of this information. Is that correct?
That is 100% correct. You can call me and I will go over everything, in detail with you, whether you, sign up with me or not. You're going to leave feeling a little bit more knowledgeable.
Amazing. They always say that there's nothing free in life, but it sounds like your company does provide you to people.
Yes, absolutely.
Well, there are so many insurance companies out there, aren't there? I don't know how they all exist, but I guess there are enough people that need Medicare
That's
HMOs and all that, it works out, doesn't it?
Absolutely.
And so how many, and I've asked you this before, I want to go over it again. So you ask them certain questions. What other questions do you ask them? So you know what to, where to fill them in, because it's kind of like you don't want to put a peg in the wrong hole, right? You want to make sure that what they tell you, but they don't know what to tell you. It's your questions, isn't it, that you can discover what they need?
Absolutely. I find out what area they're in because Miami is different from Broward. Broward is different from West Palm, the plan. So I find out what area they're in, and then I need to get a detailed list of all their doctors, all their medications, and any kind of hospitals or clinics that they like to go to. And then from there, I have a database where I'm able to put in all that information. And there's about 40 different companies out there. So instead of the client calling, all 40, they call me, I put everything in my system, and then I'll go ahead and break everything down and see what company is going to cover them at the best. And sometimes there's two, and also I'll present both to them, and then we'll go over, whichever one that they think that they'll like the best.
Okay, and then once they think that, what you told them is good, they then make the call to that company, or do you help them with anything further?
Do it all. I can do it. I can do everything online, especially since COVID. All the companies have really pushed towards online enrollment. So I'm able, from there to go ahead and collect all their information and do everything via the internet.
That's fantastic, because that was my other question. A lot of seniors really, they can get on their phones, but they're not so good on their computer. So that they try to make a phone call. There are no more phone calls. It's so easy. It's more people just have their website. But I know that your organization, of course, has a wonderful phone, and I'm going to give that out right now. And that's 954-802-0732, right? 38, sorry, 954-802-0738. That's the number to call. Again, 954-802-0738. And you'll be speaking to Cynthia Meacham. Her company is Senior Services North America. Now, do you want anyone to get on your website? I do have that to give out. Does that make any sense? Okay, Cynthia Meacham Insurance.com, right?
That's it. And they can find some good information and little pointers about Medicare and stuff like that on there as well. So
that's Meacham, Meacham, Cynthia Meacham, Meacham, and their phone number again, 954-802-0738. And that number then will get you to Cynthia. And if she's on another line, I know her enough to tell you she's going to call you back as soon as she's off. That day. She's not going to wait and make you wait a day or two. That happens all the time now. Terrible. So
terrible.
Yeah, I know it is. It's not a fair thing. Tell us, can you think of not naming the people, can you think of any particular instance that was a little bit more difficult for you and for them, and what you were able to do to, to make them happy? I'm sure that comes along every once in a while, doesn't it?
Well, they're usually happy because we're usually able to find them the doctors that they're already at, so they don't have to switch. Their prescription medication, is always going to be covered, different co-pays or whatnot. Sometimes there's two plans that are very similar, that are giving them, the doctors, the hospitals, the medicines, and then they tend to go with what their friends have or what they've personally heard from that company, and that usually helps them make the decisions. But we stick with all, the top A-rated companies. So I know that they're in good hands, whichever one they choose, and it's usually a personal preference. And like I said, depending on, what their friends may have or what they've heard from their current, friends that have these different plans. So.
And we've talked about this before, but let's say that, and this happens in companies, that somebody who they call about something, they're just not getting the right answers. They're not, it's just not working for them. Can they call you, even if it's a month or two later, and tell you that you're having problems, and you'll intercede for them?
Absolutely. Yes, absolutely. One of my clients was having a hard time the other day getting her card because she had a different address or whatnot. And I was able to call the regional sales manager up, and she called into the company, and she was so happy because she's like, thank you. You know, I've been trying to do this on my own. So I always have everybody try to call me first because I may be able to help out a lot quicker than, you know, calling through the company. So yes, that's call me first always.
And when I'm having
glad to-
computer problems, I'm going to call you first. I wish
I'm
I
not
had
trying to
someone.
get the computer,
I was
but
gonna
I'll give
say-
it a shot.
I'm just saying, I wish I had someone to call first about a lot of things that I can't do, but you know, you do know how important, knowing with this, working with seniors, how important it is that they have someone to lean on with their health and medical. It is the one thing that and money, that's what they, you know, they think about, and they have to because it's their life.
Absolutely. Absolutely. So I'm happy to, you know, be that stepping stone for them if I can and help out with anything, because I know how frustrating it can be when you're trying to call and you can't get through and just things aren't, you know, working out. So I always help to step in and see where I can push it along.
Yeah, that's terrific that you're located down here. Your company is all over the country, and I guess they have representatives like you in a lot of states and cities, don't they?
They sure do. Yeah, all the way New York, California, Tennessee, North Carolina. We were all on a webinar earlier, and they're from all over. So it's good. It's really good.
Yeah, Joe is he's very smart. He really created something that should be very proud of. How long has he been doing this?
Oh my gosh, I want to say 20 years. I know that he's had senior services for at least a decade, I believe. So he's really ramped it up, and you know, they're a family-owned business, and I can't rant and rave about them enough because I've told you before, if I can't get him, I can get his son. If I can't get his son, I can call his wife. So it's a great company, and they support us so much, and they're always giving us different benefits, you know, and different things to help the seniors, you know, along with the Medicare as well. There's a whole slew of, you know, legal side that we can help with, and extra dental and all different kinds of things. So it's really good.
Yeah, and I'm sure that, as we talked about this, but that you do intercede. Let's say that they thought, or the doctor thought, that what he prescribed should have been covered by insurance, since for some reason it isn't, and he gets frustrated and his patient gets frustrated. Can you or Joe jump in on that also?
If the medication should have been covered, it's pretty black and white. I mean, I have a whole formulary printed out, so I can look in there and see if this medication should have been covered or not. And then we can take it from there. A lot of times, you know, people are always asking us, how do we save money on our prescription drug costs? And like the first thing you can do, of course, is ask your doctor for a generic version of that. Another way you can get help is you can call into the company and ask for a formulary exemption. And that helps out tremendously sometimes. Absolutely. So that's another kind of way to help out with that. And then you can always call the drug manufacturer and ask if there's an RX assistance program, and that may help them as well. So there are a few different avenues you can take.
And would you help them with that because that might be very hard for them?
Absolutely. Absolutely. Yes.
Oh boy, Cynthia Meacham, I'll tell you, Cynthia is a godsend. I love talking to her because I don't think that I've been able to talk to other insurance, I call you representatives, with the kind of information that you know, and you have this enthusiastic way that oh yeah, just ask me anything. Oh yeah, I'll help you. Just call me and I'll do it, right?
Absolutely. If I can help it, I'll call somebody who can help us. Absolutely.
Okay, and I'm going to give that number again, and it's a 954-802-0738. Again, 954-802-0738, and it's Senior Services North America, and you're actually talking now, or we're talking with Cynthia Meacham, and Cynthia's website is cynthiameachaminsurance.com. So if you don't understand something, you have someone to lean on, because I know it's confusing. As Cynthia said, you know, there are so many companies out there, and if you call them directly, you may get an answer just from them for whatever they have. But if you call Cynthia, she'll find the right one. She's not, she's not owned, let's say, by these companies, so that she's not their representative. She's a representative from Senior Services North America, and that's what she's paid to do, to find the best for you. And that's the only way I can put this, Cynthia, correct?
Yes, I'm an unbiased resource for anybody looking to get into Medicare, whether it's, Advantage plans, supplements, chronic special needs plans, and dual special needs plan, Medicaid, Medicare. All these companies also have a bunch of different plans, so then they get confused of who should I go with there. So that's also, another route is for, the low income subsidy. If you make less than $1,436, you qualify for full help, through Medicaid. A couple is $1,940 a month. If you qualify for that as a couple, you can get help with your premiums, your annual deductibles, your co-insurance, your co-payments. So, and then there's also extra benefits that they don't have with Medicaid alone: the dental, vision, hearing, over the counter, and even that monthly healthy food card that we talked about as well.
Talk about that again. I think was so exciting to hear.
Yes. So if you are Medicaid, Medicare, you usually have a dual, which is a dual special needs plan. And what that is it's going to cover you pretty much down the road on everything, 100%. And then they give an extra benefits that Medicare and Medicaid alone does not. And one of them is a healthy food card, and they'll give you up to $50 a month to go get fruits and vegetables.
See, and your organization,
staying healthy, eating the right
thing. And you understand that because I don't know if all representatives, if you call just any company, if they would know that, you see. Maybe they're supposed to, but I have such faith in you and what you tell. And I actually told someone to call you, but I don't think they were a Medicare person. They just need to know about COBRA. I said, well, I only know one person who you could talk to, and I don't know if she can help you with that, but if not, she'll find someone that you can talk to, right? No, if you got that message, but I did have someone call you that wasn't Medicare.
You know that I'll try. And if I can, I'll give them to the right person if I can't help out. So that's no problem. You
sound like you could actually be in charge of a lot of things. Why did you choose to be involved in Medicare with the seniors?
Seniors are just a different breed. They're not like they are today. Seniors are much easier to work with for me. I feel like I can help them a little bit more, and I have an attitude of like, I'm not here to sell you, I'm here to help you. And we just built such a great relationship that I turned off of individual a long time ago and went on to Medicare, and there's just no turning back for me.
Oh, they're so lucky to have you. Where did you grow up?
Here, actually. I am born and raised at Fort Lauderdale, born in Hollywood.
Terrific. That's unusual. I guess you're still young enough, and you.
Yeah.
And so you understand this whole area. The 3 counties are very powerful, but so and let me just ask you about that. So let's say someone's living not in South Florida. Can you help them also if they live in Florida?
Absolutely. I can help you in Florida. I can help you in New York. I can help them anywhere. So like I said, I take your zip code, I find out what, area code you're in, and then I have the whole slew of plans that pop up for us, and I can do everything electronic. So it really doesn't matter where you are, but I have my Florida, and then I have my New York non-resident license as well.
Oh, you see, so that's a great plus, because there are people who, if they call one of the Medicare numbers, and they're being advertised everywhere, call the Medicare, they can't do that. They're just interested in their own company right here, or companies in South Florida. And so that's extraordinary. I don't think we ever talked about that before.
I'm able to help out, wherever. So it's very good.
Because we do have a lot of South Floridians who have family members up in New York, different places, and they want answers. They don't just want to be told, no, you can't have this, and no, you can't have that. The other thing that I wanted to continue on with what you said was, if someone, let's say they're just going to be turning 65 in a few months, you said that they could then find out everything ahead of time, signed up ahead of time before the 65?
That's right. They have 3 months before their birthday month. So if they were turning 65 in October, they would have July, August, September, their birthday month of October, and then September, and then October, November, December, January to sign up for their plan. It usually takes about 60 days from the time you call Medicare to get your Medicare card, your red, white, and blue Medicare card. So I always make sure they're calling at least 2 months ahead of their birthday. So they have the card, and then we can go over all their options, Medicare Advantage, Medicare Supplement, for heaven bids, chronic special needs plans or whatnot. And that way, when they turn 65 on their birth month, they are covered.
Oh, so that was my other question. So they're not covered until their birthday, even if they've signed up. It's starting with their birthday day?
There's on that month. So if your birthday is June, 25th, your coverage starts June 1st.
I see. Okay. And the other thing is you talk, and I know how important it is. People have doctors, and that's where I think you said once before, you look up their doctor and what plans they're on. But let's say that there are much better plans for them. Do they then, would they ever give up their doctor?
It depends on the doctor. They usually always keep their primary care because that's in the long haul. But a lot of times people haven't seen their cardiologist in 5 years or their dermatologist or whatnot. So a lot of times those are the doctors that they don't mind switching for the most part on there.
And you actually tell them about people other than their general practitioners? I mean, so if they tell you that they have a heart problem, you're going to look at the doctors, the cardiologists.
Well, I'm going to see, well, they have a heart problem. They already probably have a cardiologist. So I'll look at those chronic special needs plans and I'll see which one is covering their cardiologist.
Okay. And as you said, if they haven't seen that person, it doesn't matter. But what about the GP? Are they pretty close? I mean, they'll say, I only want to go to a plan that I can use this doctor?
Usually, yeah, because they've been with them for so long, and I don't even tell them I wouldn't even tell them to switch off because they know their history and they know everything about them. And 99% of the time, all these doctors are taking Medicare Advantage plans. So I never have a problem finding their doctors and network.
That's what I was going to ask you. So do most doctors take all the plans or a majority of them?
Yeah, all your top carriers, your Aetnas, your Humanas, United Healthcares, Blue Cross, all of your big carriers. Most of the time the doctors are accepting them because like we talked about before, most people are going on in Medicare Advantage plans. So the doctors kind of have to keep with the times and, accept them as well.
Okay, now I have a trick question. How about concierge doctors? What should people be doing about them?
Concierge doctors, they're paying for on their own. I have, clients that have PPOs and they still do the concierge on separately, just so they can get a call in first or whatnot. Like my doctor does it and it's just an extra cost every year. And it's so I can, call in to see him or he can come see me or whatnot, but that's usually not really covered by the plans. That's usually a separate cost that, the client chooses to pay.
But a doctor can be a concierge doctor and also take Medicare patients?
Sure. Yeah. They're probably getting the concierge on the cash side, but not through the insurance companies per se.
Okay, so if a concierge doctor is there, the A part of it, the hospital will take care of them. It has nothing to do with the concierge part, right?
Well, when we say concierge doctors, we're talking about a doctor that has like a VIP service per se for their yes. So sometimes those doctors still take plans and then do the concierge on the side or whatnot.
I see. Huh. It's a little confusing to me because I didn't know that they could take anything else if they, so they take their own, but then they can't take Medicare for that patient. They can only do their own payment.
You're probably correct.
Mm-hmm. And you do have some people that choose to do that?
Yeah, I do. The one person comes to mind because he was just calling me about it last week. So yeah, I think he's going to do that as well. He's not paying anything for his PPO Medicare Advantage plan. So for him, it's like, it's worth it, because he's not out of pocket anything on his Medicare Advantage. So.
Right. So let me ask you that I am on Medicare, and when I call my doctor's office, first thing, of course, now they know me, but the first thing they want to know about my insurance. Why do they want to know? They want to know if I'm covered because
They
of
want to,
their plan?
that's exactly right. They want to make sure that the doctor takes that plan.
And you
But
said
if you
that
have,
most,
yeah, if you have a supplement, as long as the doctor accepts Medicare, you have no worry, you're in.
exactly. But there are people who call and they won't accept that person because they, if they don't have that plan, right?
That's correct.
Yeah, I've heard that.
That's correct.
But that's their choice. That's the doctor's choice not to do it for some reason, right? I mean, they don't accept all plans.
That's correct. They all have a contract between the doctor's office and the insurance company. So,
Right. But it's good to have someone like you to be here. I told you this before, and I don't want you to get a big ego, but I've been a gerontologist for a long time, and what we're talking about now has always been confusing, and I have never met someone as smart and as open as you. I mean, you're a real fresh breath for.
thank you, Anita. I appreciate it. Thank you.
Yeah, and I don't say that casually because people ask me and I don't have a lot of answers. It's not my business. I don't know. I just, and I've never had anyone to refer to, but I'm so glad now that I have you. But just call Cynthia Meacham and she's going to tell you what to do. Her treasure, Cynthia. It's so nice to work with you. I get the feeling that we're probably out of time. So we're getting close, if not.
Yes.
It's wonderful. And I guess, so today's only Wednesday. Boy, the weeks go so fast. And now without COVID, I mean, we have COVID, but we have a lot of people more relaxed. So it's going to be interesting what happens in the future. Did any of the HMOs change any policies with the COVID that we didn't hear about?
COVID is pretty much covered on all the plans, HMO, PPOs, or whatnot, but a lot of their treatments are being covered when their clients out zero. So they're really taking care of everybody for that testing, if everybody's are diagnosed or in the hospital or whatnot. A lot of times the treatments are zero for COVID. And they even state that now in all the summary of benefits, it says like COVID treatment, zero. So it's, yeah, they've definitely stepped in to make sure we're taken care of.
Yeah, that's really excellent. And I know that there are people out there who are now being tested. They don't know what they're supposed to do. Should they wear the mask? Should they not wear the mask? And so if they're going to ask their doctors, and I was hoping that a lot of the shots were going to be given in the doctor's offices. But I spoke to my doctor. He said they haven't given us the stuff yet.
Isn't that weird? Yeah. Time, your Publixes and they're outsourcing them. So hopefully sooner or later our, primary care doctors have them so they can do it like they do the flu shot inside the office.
Exactly. Yeah, exactly. Because I think it's more trusted and I think they should do that. But I'm hoping it can get done quicker because I don't think the other is as good an idea. But I have to talk to some other doctors and they'd be very willing to do that. I don't even know if we're going to wind up with a booster shot. I know I'm waiting I always get my flu shot at my doctor's and that doesn't happen, I think, until September or something like that. But, you're really in the middle of it. And I guess the Medicare isn't going to change. Everything that you're working on, it just stays the same. It's we call them Medicare beneficiaries and you really do derive a benefit from this. I must say that it's so wonderful that the older adults now don't have to worry about their health care. They have to take care of themselves, but they have all this going. So I've just been told that we have to say goodbye. And
all right, Anita.
Let me give your phone number out again. It's 954. 802-0738. And that's Cynthia Meacham. And thank you again, Cynthia. Bye.
Thank you. Bye.
Thank you too. Goodbye.
Bye-bye.